joining me for today's webinar all about Patient Assistance Programs, or PAPs. My name is Kim, and I am the PAP Research Manager at Needymeds. Before we get started, I'd like to offer a few tips so you can make the most out of the presentation. You can ask questions by typing them into the questions section of your GoToWebinar control panel, but I will answer the questions at the end. If I don't get a chance to answer your question, I will follow up with you by email. Also, I will provide our contact information at the end of the presentation. This webinar is being recorded and will be available on our YouTube channel. A copy of the PowerPoint slide deck and other materials we thought you'd be interested in can be found in the handout section of your control panel. With this presentation, I will cover what Needymeds is and what healthcare savings we offer, what PAPs are and how they can help you save on your medications, how to find PAPs on our website, and finally, I'd like to offer some additional tips about PAPs. So let's go ahead and get started with what is Needymeds. Needymeds is a national nonprofit founded more than 2 decades ago by a retired physician, Dr. Rich Sagel. On the screen, you see our mission statement, but simply put, Needymeds connects people to programs that will help them afford their healthcare expenses. We do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. And one of the most popular and effective ways we help people save on prescriptions is with our large listing of PAPs. So PAPs are usually supported by pharmaceutical companies, and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually brand name, to those that qualify. Of course, not every drug will have a patient assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare provider usually needs to be involved by providing a prescription, signing the application, and submitting documentation. So be sure to let your healthcare provider know you are applying for financial assistance. They might even be able to help you with the process. So how do you find PAPs on the Needymeds website? Let's go ahead and switch to the live website so I can demonstrate. The most common way to search for medications is with the drug search. At the top of our website, simply type the generic or brand name of drug into the box and then click the drug search button. Or to specifically find PAPs, click on the Healthcare Savings tab where a drop-down menu will appear. This shows you all the different categories of savings, including $4 generic discount drug programs, free low-cost sliding scale clinics, coupons, rebates, and more, diagnosis information pages, diagnosis-based assistance programs, help with medical transportation costs, retreats, camps, and recreational programs. You can apply for scholarships, government healthcare programs, and the Needymed drug discount card. If you want to learn more about these other resources, I encourage you to sign up for one of our monthly overview webinars. You can register for one on our calendar events on the bottom right hand of the homepage. But today, our focus is patient assistance programs. So to find a PAP, go to the Healthcare Savings tab and click on brand name drugs. The first thing you're going to see are a bunch of icons at the top of the page. What these icons do is they show you what type of information is available for that drug. If you let your mouse hover over the icon, the definition will appear. So is there a patient assistance program? Is there a $4 generic program? Is there a coupon, a copay, or a rebate? Is there additional information on our support pages? Is there a short video? And finally, a link to drugs.com where you can learn even more about the drug. You will also notice an A to Z index. The large categories on our website will have this to make your search easy. So let's do a search for a common brand name drug. Let's try Epclusa. So click on the E and scroll down until you find Epclusa. And as you can see, there's more than one option available. When there's more than one, click on both, and then go ahead and choose the one that best suits your needs. When we click on the link, there are those icons again. For the Epclusa tablets, we see that there's at least one PAP. There's a coupon, a rebate, or a copay. There's additional information on the support pages. There's a short drug video available. And there's also a link to drugs.com. So let's click on the icon for PAPs. Look at the blue bar at the top. It reads programs 1 of 4. That means that there are currently 4 PAPs for Epclusa. So let's go ahead and scroll down to see all 4. Good Days is the second one, Healthwell Foundation is the third one, and the Patient Access Network Foundation, or PAN, is the last one. We're going to scroll back up to the top, and at the top you see the program name. The way that we organize our programs is the one that offers the most assistance will be provided at the top. So in this case, out of these 4 programs, the Support Path Patient Assistance Programs offers the deepest discount. Importantly, right at the top is the name of the program and the contact information. Be sure to direct all your questions about the PAP to the contact information listed here, as opposed to Needymeds. Underneath the program name is a short sentence that describes the type of savings the program offers. If there's more than one program with the same type of savings as in this case, the programs are organized alphabetically. Next is the application section. Pretty much you'll always find a PDF of the application, like in this case, but in the rare case that an electronic application is not listed, there will be a hyperlink to additional information. Underneath that is the medication section, and you will find the medications that are covered in this program. In this case, both the pellets and tablets are included. Each program also lists an eligibility section. Although eligibility will change from program to program, it is almost always based on 3 factors: insurance coverage, residency, and income. So I'd like to talk about the income requirements briefly. Often income requirements are based on a certain multiple of the federal poverty level. But how do you know where you fall? Right here, you will find the federal poverty level income calculator, and I'd like to demonstrate for you. So you just click on the link, and up pops a screen. So hypothetically, let's say that a family of 3, and you just type in 3, has an annual income of $90,000. And a quick tip, do not use commas or dollar signs when entering the income, just plug in the digits. Be sure to change from weekly to yearly if it is your annual income, and then just click calculate. And down here is the answer. So in this particular case, the yearly income is 409% of the federal poverty level. And as you can see, for this particular program, the individual needs to be at or below 500%. So they definitely fall within the guidelines. But what happens if the calculation shows he is not eligible, is just above the eligibility requirements that say 510%? Well, when that happens, don't despair. If your income is slightly over the income limit, go ahead and apply anyway. You can ask the program to make what is called an economic hardship exception. If you are denied, always be sure to appeal. So let's talk about residency. Do not assume that if you are working with a population that is undocumented, that they will automatically not be eligible. Be sure to check out the residency requirements, where we will provide the information for each program. If you are unsure or have questions, call the program directly. The rest of the page will show you other important details, such as what the doctor needs to do, what the patient needs to do, if accepted into the program, where the medication will be sent to, and how to reapply. And finally, always check the additional information section, because that's where we put other pertinent information that does not fall neatly into the other categories. We understand that PAP applications can be really complicated. So if you return to the Healthcare Savings tab, you'll see a link to help filling out prescription assistance program applications. We've put together this directory that lists nonprofits that help people apply. The places we list are usually free or will assist you for a very small fee. And for the healthcare providers joining us, I'd like to point out two resources under the Education tab. On the left-hand side, you will see Paps Tracker. And this is a software that eliminates the administrative burden of manually submitting and tracking PAPs, and there is a fee for Paps Tracker. Underneath that, you will find another resource named PapShare, which allows you to incorporate our listings of PAPs directly onto your website, and PapShare is free. If you want to learn more about Paps Tracker or PapShare, I'll provide contact information at the end. So let's go ahead and transition back to the PowerPoint presentation because I'd like to provide you with a few PAP tips. You will find a top 10 PAP tips document in the handout section of your control panel. Also, remember that you can ask questions by typing them into the questions section of your control panel. So let's go ahead and talk about PAP tips. Don't take no for an answer. Even if you are not sure you fall within the eligibility guidelines, submit an application anyway. If you are denied, ask the program to make an economic hardship exception. If you are denied, always appeal. Find out if your doctor can prescribe a different medication, maybe a generic medication that is more affordable, or a medication that does have a patient assistance program. If you are getting information about patient assistance programs from a source other than Needymeds, make sure it's reliable. You should never have to pay to obtain an application or apply to a program. We hope we are your go-to destination as we pride ourselves on the information we share being accurate, easy to understand, up-to-date, and free. When people are afraid they will not be able to afford their medications, they may wind up turning to sources that are unreliable, such as mail-order pharmacies, and be very wary of mail-order pharmacies outside the U.S. or pharmacies that do not require a prescription. And yes, you can apply to more than one program at a time for the same medication. Remember, be sure to cover all your bases. If you are taking more than one medication and you cannot find a program for the most expensive, check out your other medications to see if there is a program available for those. Alleviating the cost of those other medications may free up your budget so you can afford the more expensive one. Under the Healthcare Savings tab, you will find a category for diagnosis-based assistance programs. If you are seeking assistance for a medication related to a specific diagnosis, such as diabetes, check out the diagnosis-based assistance programs to see if there is other financial help available. When dealing with our call center counselors or the program itself, err on the side of providing too much information as opposed to too little. Giving our counselors the full picture may mean that we can find other assistance you didn't even know was available. And when dealing with patient assistance programs, read through the application to make sure you have included all necessary documents and have completely filled out the form. You don't want to be denied or delay the process because there was documentation or signatures missing. Also, call our expert call center counselors at 1-800-503-6897. They are here to help exhaust all options and may be able to think of a solution outside the box. And sometimes, unfortunately, illness can be a family affair. While we're helping you, you may realize we'll be able to help a family member as well. And one final bonus tip. If your medication will be discontinued, there's generally a grace period when you can still get the medication, providing you followed the re-enrollment guidelines. So be sure to check with the program to see what you need to do. So let's go ahead and get to those questions, because I see a few came in. You can type your questions into the questions section of your control panel. While I answer, I'll leave up this slide. If you'd like to order some of our educational brochures or drug discount cards, have questions about this webinar, or would like to learn more about PapShare, please email info@needymeds.org. To inquire about Paps Tracker, please email my colleague, Sam Landry, sam.landry@needymeds.org. For help connecting with healthcare savings programs, reach out to our call center counselors. at 1-800-503-6897. We are open Monday through Friday from 9 a.m. to 5 p.m. Eastern Time, and we do have Spanish-speaking counselors. And of course, check out our website. So let's go ahead and get to some of those questions coming in. The first one, what happens if I can't find a PAP? That's a great question. If you are looking for help affording a brand name medication and there is not a PAP, be sure to check out our coupons and rebates as well as diagnosis-based assistance programs. You can find these resources under the Healthcare Savings tab, just where the PAP section is. If you don't find a program, you can always use the Needymeds drug discount card to save up to 80% off the cash price of your medication. And also with our drug discount card, you can save 40% off medical equipment. You can request a card from our website or by giving our counselors a call. Also, remember to check back. If you don't find a patient assistance program today, one may be added at a later time. Next question. You mentioned this webinar is being recorded. Where did you say I can find it? You can find all previously recorded webinars on the Needymeds YouTube channel. There is an icon for it at the top right of our homepage with all the other social media icons, and it's the third one from the left. I suggest subscribing so you know when new content is being added. And a reminder, you can find all upcoming webinars on the calendar of events on the bottom right hand of our homepage. Next question. Can I apply if I have Medicare Part D? Well, honestly, it depends on the program. Some will definitely let you apply. Others will determine that on a case-by-case basis. You will see the answer to that in the eligibility section of the Patient Assistance Program listing. Always be sure to call the PAP program and speak with one of their counselors, because even though the website says you can't have Medicare Part D, they may still be able to help you. We try to keep the question segment brief, so if you asked a question and I did not get a chance to answer it, I will email you, or you can reach out to us at 1-800-503-6897. For now, thank you so much for your time, and we do hope you will stay in touch.